Robert, to miss any of this, because we were just kind of getting into some improvement in your symptoms, and I thought it would be worth documenting that and telling people about your kind of unique symptoms as well as improvement.
It's remarkable what she's come back with, you know, her face, her eyes, like she was saying, her hearing is coming back, but she used to struggle to walk. I mean, her feet were just...
My left side would almost drag in the morning, and my legs, my lower legs and my feet felt like they were glass. Like when I stepped on the floor, it was just going to shatter. I mean, so painful. And I've literally had none of that. None of that.
Right, those are the arthritis types of symptoms you said you were having?
Mm-hmm.
Okay.
Mm-hmm. And then the pains in my neck and my shoulders, mainly it was just my neck and that was the worst. I felt it in my elbows and my wrist and my knuckles and my knees, and everything that could bend felt like it did not want to bend, and there was just pain there. Not only with bending, it was there 24/7. Even if I would just sit like this, I would feel the pain, but it would hurt more if I were to use them. I don't have that. I have a little bit left in my neck and shoulders, and I think, well, I've got that frozen shoulder going on, so I think that's a little bit of an issue with that. But other than that, I mean, I think I was telling her, I just feel like I've been reborn.
She's breathing better through her nose. She used to lay in bed and be stopped up, and she'd breathe out her mouth and snore. Now she's sleeping with her mouth closed and breathing through her nose, and it's just amazing.
Yeah, because my left sinuses were so messed up for ages.
So it sounds like just kind of general inflammatory symptoms kind of in multiple areas throughout the body.
Mm-hmm.
And as the inflammation systemically is going down, you're noticing improvement in all these types of associated symptoms. I think it's important to also just mention again, because we do hear patients that have neurologic symptoms. So in your case, the hearing is of particular interest to me because that's a little bit unusual, and you wouldn't associate obviously like improvement in your hearing with taking your implants out, and that's not always one of the stereotypical symptoms that patients complain of or we expect to see improvement in, but maybe you could just mention again what types of improvements you've noticed with your hearing since having gotten the implants out just less than 2 weeks ago.
The very first night, which would have been the 21st, Monday night, I woke Dave up because I couldn't sleep, I was in pain. I was watching TV, and I had the loud pitch in my ear, and I thought, well, that's kind of strange. So my first test is to lay on that right ear, the only one I can hear out of, and I could still hear the TV. Now, it's not where I would like it to be, but I could hear something. I was crying. I woke Dave up in the middle of the night, and I told him, I said, you're not going to believe this. I could hear something out of my left ear. And then it was 2 days after that, and it was during the day, and I had the high pitch. It was the same pitch in the left ear. I'm like, well, let me try this test again. And it has come up some. It's still not where this ear is at, but this ear has just been dead. It's just been turned off. And now it is not. It's back on. So I'm just hoping that...
Keeps getting better.
Yes.
Wow.
Yes.
Yeah, that's amazing.
Even if it stays where it's at, I'm still improved. So...
And all her symptoms has been on the left side, the left shoulder, the left
ear, left teeth.
left side of her mouth.
Your tooth.
Yes.
Explain about the pain in your tooth is gone.
Yeah, the pain in my tooth. I had a root canal done a little over a year ago, and it caused me so much pain. It healed, it kind of healed, and then it came back full force about 8 months later. They went in and through the top of my gum and took the roots out from the top, not just from the underneath of the tooth. And I was told that that will never hurt me again because there's nothing there to hurt. That's a lie. Because there is something there that causes pain. It was in the gum. Where they put the 6 stitches in my upper gum, did not want to heal. It wasn't open or oozing or anything, but I know my body, and I know that it was not healing from the inside. It caused me pain. I had pain like down along this, down right here on the front of that tooth. Tuesday, there is no pain. I've not had no pain in my teeth. Usually if I do that, put pressure on it, that would drive me through the roof. Touch it, there's nothing. It's just like there was
Your
never,
body's just working.
Yes, and I'm very grateful for my body. I'm trying to teach her and give her love and kindness. And
Good. Well, you need to recover. It's a process, so
Yes.
it's not going to all happen overnight. But typically we see patients continually improve over 6, 12 months, even 18 months after surgery.
And I'm thinking,
so.
my gosh, if I've already done this in this little bit of time, what the heck am I going to be like in a year or two?
I can't wait to see.
Yes.
Don't be surprised if you lose like a lot of weight. So.
Well, that would be fine.
Yeah.
That would be fine with me. And I want to get back out into my yard and do my gardening. That is my favorite hobby, and that was one of the last things that I allowed myself to give up.
Couldn't do it because of the pain.
Yes.
Okay.
The pain, the heat, the dizziness, the fatigue, and it's just...
So you got like another chance at life.
Oh, definitely.
Yeah,
Definitely.
the last 2 years, it's just been holding the couch down. That's all she
That's
can
it.
manage.
How many
Get out of
doctors have
bed.
you been to?
How many what?
How many doctors have you been to with her?
Well, numerous doctors, and every one of them knew that she had implants. Every one of them. But they wouldn't, there's nothing wrong with you. There's nothing wrong with you. That's all they would tell us. Her blood pressure's good.
Blood
Heart
work's
rate's
good.
good. Blood work's good.
Scans are good.
Nothing wrong with you. You're fine.
And even if I'm sitting there just bawling like a heap on the floor because I'm so frustrated and just so sick and tired of being sick and tired, what do you want me to do? There's nothing wrong with you. Well, I'm human and I'm trying to tell you there is something wrong with me.
All they want to do is prescribe a pill to keep her
Yeah, that's a pretty
spaced
powerful
out.
story. So how did you, just to kind of refresh everyone's recollection, how did you learn about breast implant illness and find your way to see me?
I happened to be looking on Facebook and something, I wish I could pinpoint the exact thing that drew me to that, but there was something on Facebook and I clicked that link and then it said to join and I had to fill out a couple of questions, and within probably 5 minutes of being on there, I knew. I knew this was it. And I dealt with it, I looked at it, I read everything, all the information that I could get my hands on for about 2 days before I even said anything to Dave. Because it was just so surreal that...
You found something.
How can this be?
This
It's like,
Nobody-
this
nobody
has
told
been
me.
here and
Right.
where have I been at?
Right.
And then I talked to Dave, and Dave said, if that's what you want to do, I think that's what we need to do, and do it as quick as you can do it. So I started looking at the doctors on the site.
This is the Healing Breast Implants by Nicole site,
Yes.
I assume? Okay.
Yes. And I researched Dr. Musat in Chicago. I sent an email to your office and to a doctor in Sarasota, Florida, because I have a really good friend that lives there. And I was wondering, maybe I'll just go down there, have it done, stay with her. And on a Saturday, I got a response from Laura and talked to her for about an hour and a half on the phone and just blew my mind away. Number one, that I got such a quick response, and number two, that I was actually talking to a person that knew what I was going through.
That's why she's here.
And that...
It's the validation that really makes a
It
difference,
is.
right?
And
You're like, I'm not crazy.
that's the first thing
Right.
she told me, is you are not crazy. And I'm like, I knew I wasn't crazy, but 12, 15 years of going through this, sometimes it does make you feel like you're crazy, and you do doubt yourself, and it's like, well, maybe I'm not seeing what they're seeing.
Well, maybe when you got, numerous doctors and physicians and professionals and tests telling you that there's nothing wrong with you, then obviously
Right,
you're
where am
gonna
I
start-
coming up with
You're going to
this?
start questioning your own sanity.
Yes, and you do.
That's the scariest thing, that these doctors, and we've seen hundreds of doctors that are just telling you, there's nothing wrong with you. There's nothing wrong with you. And
then, you need to see, seek professional help, seek mental health, and I did not have any problem going to seek mental health. I mean, it kind of pissed me off because I thought they were just brushing me aside because I didn't think it was coming from mental issues. I've had some depression, but the depression is because I can't figure
You don't
things.
feel good, yeah.
can't figure things out and I don't feel good and I don't have the motivation and okay, today am I going to be able to get up off the couch and actually take a shower and then sit back down on the couch and wait for a time to go to bed. Then you wake up and you do the same thing. And it's like, okay, well maybe tomorrow I'll clean up my car. Maybe tomorrow I'll go wash it off. Well, there ain't none of that shit going on. You know, you think it and you want to, but you just physically can't do it. So I've seen all the, all the mental health professionals, and they're like, well, there's nothing
to do. Take these pills.
Exactly.
That's what everybody wants to do.
And I am not a pill person. I do a lot of things holistically, and no, I don't need to take the gabapentin. I don't need to take, 200 milligrams of an antidepressant, and you don't need to be changing this every 4 weeks when I come in and see you. No. And then when you have that attitude, they don't want to see you anymore because you're not doing what they recommend. And they don't like for you. Yeah, I speak a lot, as you can probably tell, but I speak my voice. I want it to be heard, and if I don't agree with you, I'm going to ask you questions, or I'm going to ask you why. I'm not just going to say, oh, okay, give it to me.
Yeah, and I think, this is a common problem that we hear not only from patients that have breast implant illness, but, patients in general. And I don't think the physicians or the specialists that you see are doing anything wrong. They're just doing what they know how to do.
They do not know.
And they're not aware of breast implant illness. That's why we're making, this type of documentation and trying to get the word out. But they're not familiar with it. And they're taught, like me, in medical school, that if there's a problem or a symptom, you treat it with medication. Mm-hmm. And that's just the dogma of healthcare today. And unfortunately, that doesn't work for a lot of patients anymore.
Well, not in this circumstance anyway. But
I don't think there's any pill that you could ever give a person like that that's going to make those better. Mm-hmm. I don't think there's anything out there that make them better.
No, but as you know, and believe it or not, there's millions of patients like her out there suffering, with and without breast implants that are being, treated and having their symptoms treated with different types of, medications that, this is kind of a bigger conversation, but, Laura knows these pharmaceutical companies are getting rich, and it's at the expense of patients that are, being overly medicated.
Yeah.
Yeah, but I've got my voice now and I've got my health, and it's just a matter of time because every one of them people I'm going to help enlighten them.
Well, I think this has been a great story. You highlighted a lot of important issues. I think you really did a great job kind of encapsulating a lot of the breast implant illness specific types of scenarios that our patients run into along the way until they get to a point where they're ready to make a difference in their life. So thank you for sharing all that.
You're welcome. Thank you for giving me my life back.
Yeah, well, these are the great stories that we like to hear from patients, and then hopefully use to educate and help promote, additional patient advocacy so that other patients are familiar with what breast implant illness is and can get treated if that's something that they feel that they would benefit from.
Well, one thing I'd like to add is the last 5 years I've been seeing so many doctors because of that left rib cage there underneath that left breast, and it just felt like my whole left side from my foot, from my collarbone, was just compressing. And I would tell them that, and we did every scan, every MRI, everything. Nothing. I've went to all kinds of alternative therapy, from massages to needling, body work, unimaginable things that I have done to try to alleviate what is going on with this left side. Once I seen the pictures of what came out of that left side, I finally understood what was going on in there with the glueness and it being stuck. And that was the main thing that I kept trying to tell people. It feels like it's stuck. If I could just go in there and just cut. It's like if I could take a knife and just cut something in there and let that go and create space, I would be okay. And they're like, well, you can't do that. I'm like, well, no, I can't. I'm not a doctor.
She actually had a rupture on that side, and they left the capsule in. So it seems like that side with the capsule was just a little bit more when you were
explained to her, so maybe that's where all those issues were from your prior surgery.
And
Yes.
that's all gone now, you're saying?
Yes.
So symptoms
Yes.
are gone?
Yes, it's all gone. It's like, I was telling my health lady, I said, it feels like I've got like cotton candy air balls in there is how I explained it to her. Just like it's just all soft and roomy and
Range of motion is better, and just,
She looks different. What do you keep doing in the mirror with her in the car? What do you do? It's so cute. What is he doing?
hold it down, see the beautiful girl.
yeah,
Got her
he's
back.
got his girl back.
Yeah, she's got the light in her eyes again.
She's got that sparkle and.
So is this the left one and that's the right one?
The bottom one's the right one, the top one is the left one. So this is left and right.
Okay. That's just amazing.
Good. Well, this is a good Christmas time story.
She might
Oh,
write a book.
isn't it though?
Yeah.
She's thinking about writing a
Best Christmas
book.
gift I had.
Right.
Yeah.
You can make a whole Christmas movie out of it.
Yep. Yep. And we were talking down in the vehicle earlier and he's like, who would have thought 2020 would have been the year that we found out
Not
what
a
was
good
wrong
year for
with
most
you?
people, no.
No, but you know what? It'll be a year I'll never forget.
Yeah,
And it
I
won't
think
be-
all of us.
It won't be because of the COVID, it will be because of this. So,
Well, we're hoping 2021 is going to be better for everyone.
oh, amen to that.
All right, good. Well, we went over kind of all your specific instructions. I'll plan to see you back. We'll get the drains out today, so you'll
Okay.
feel better. She's not even 2 weeks out from surgery. And then we'll plan to see you back around your 1 month mark.
Okay, sounds
All right.
good.
I'm really happy for you.
Oh, thank you so much. Thank you. I
All
hope
right.
you understand what you do for
Yeah.
us women. I mean,
Well, I appreciate when you remind me about it, because, you know, obviously we're in a daily grind too, so
Yes.
it's nice to hear the
Yes.
stories every now and then to know that what we do is helping patients.
because you will be one person I will never forget my whole entire life.
I appreciate that. Thank you.
Thank you.
You're welcome. Glad I could help you guys out.
Okay, well go do your magic.
Thank you. Happy New Year.
You too.